anti-trans laws and through the ways that society has weaponized that anti-trans ideology, you really start to realize that like a lot of people don't care about trans lives.
Being in Texas, being in a state that is actively, trying to remove my rights as a human being, and is hostile to me as a human being in many ways, is really scary.
And these politicians inflicting these new legislations on doctors, people that are helping the community, is wrong. There is no space for politics in healthcare.
By mid-year 2024, over 500 anti-LGBTQI bills had been introduced across the United States. Most of this legislation was deliberately aimed at restricting equal treatment for transgender people.
My trust is not so much broken with the medical industry, but instead with my state legislature. They've very much made it clear that they do not care about people like me, and only use us for political gain.
Concurrently, the U.S. Trans Survey released a new wave of findings showing that the U.S. trans population already suffers a significant level of discrimination, including nearly a quarter did not see a medical provider in the last year due to fear of mistreatment.
I don't really trust these spaces as a trans person, so I'm not really getting, my cancer screenings or my well woman care or any of that good stuff.
Of those that did, nearly half reported at least one negative experience due to their trans status. 44% experienced severe psychological distress in the last month. 39% reported being harassed in the last year. Whether these laws are passed or not, they're fueling a climate where people feel free to discriminate against trans people in healthcare, including medical providers, and that affects our access to screenings and treatments.
We're having providers leave the state in fear of losing their license because they're providing care. 2 years ago, I was having some issues after an elective surgery. And those issues were concerning to her that it could possibly be colon cancer. So she recommended me to go to a specialist to have a colonoscopy 2 years ago. I just received that colonoscopy right before she left the hospital.
I don't think it's fair to the doctors to have to uproot what they've started to move to another space and leave their clients.
And during the process of the hysterectomy, they found a concerning, lump. And I have not gotten that checked out yet because I'm afraid of medical mistreatment. And that scares the shit out of me, frankly.
You have providers who don't want to help, period, whenever they know that you're seeking gender care. And then you have other providers who really want to help, but their hands are tied and they can't help because of these new laws.
I am seeing patients who are really struggling with what's happening and really having having to make decisions about whether or not Utah is going to continue to be a place where they can thrive and live and enjoy being here, and that's really been a struggle.
We found situations where even those of us who are better resourced are still struggling to get to welcoming medical care.
I'm relatively affluent, I'm highly educated, I'm white. All of these things are super impactful on my ability to access medical care. I have been treated much more like a medical specimen than like a person in many cases. I have been a scientific curiosity.
It's a little scary going to a doctor and not knowing, are you one of the people who would wish that I'm not here? Because in a way, my life could very well be in your hands. And especially when it comes to important things like cancer screenings or emergent care or urgent care, infections, things like that.
We also found how the laws are written so broadly that they impact non-transgender people who are going through cancer treatment because of the additional hurdles that have been put in place aimed at restricting trans access to care.
Not only are these laws affecting the intended audience of our trans siblings, but then they're also catching people like cancer patients and other people that have medical needs almost as collateral. It's utterly repulsive.
And that's where this legislation is so very harmful, because it just takes away all of these resources that affect us in this very systemic way.
The biggest theme among the interviews was that everybody was experiencing some level of a hostile medical environment, so we triaged our very top health need, which was usually hormones. But those providers didn't often realize that they were then our whole healthcare team. So we were reliant on them for well-person care and cancer screenings too.
And once I started transitioning, it became pretty clear that I was not really going to be taken care of very well by that office.
And so I went from a doctor that was 2 minutes away to a doctor that was an hour away. And made that decision because that doctor was confident in gender affirming care. And that doctor felt welcoming.
One of our biggest lessons about how this legislative wave is affecting people is that whether or not it's passed, it is fueling hostility in the healthcare world.
It's incredibly important for organizations to stand up for gender expansive people across the country. We've got to have allies, and some of those allies have to be larger organizations who have the ability to affect change. It's critical.
So if you care about making sure that all people in the United States are able to access the care that they need and keep themselves as healthy as possible, minimizing our risk for cancer, getting our cancer screenings, getting our cancer vaccinations, then now is the time to stand with us.